Here at HealthArt, we are starting with nutrition. We're teaching 4-week classes to the patients that are interested in changing their lifestyle. We start with the anti-inflammatory pyramid of foods, and we teach what to eat, how much to eat, and how to prepare. Anti-inflammatory diet works by lowering the sugar content or the glycemic load or index. What happens is we dump, in a typical diet, sugar into our system, and it acts as an inflammatory marker. The glucose does. And with the anti-inflammatory diet or nutrition guidelines, we use foods that are on the lower glycemic load parameters, and so the body doesn't have to respond in an inflammatory way to the nutrition. A lot of patients come in and they want to know, how do I get off my medications? And that's a big question, because you don't know if they'll ever be able to get off of their medications. But you can start with nutrition. In integrative medicine, we use what's called the anti-inflammatory food pyramid. It's by Dr. Andrew Weil. He has studied the Mediterranean diet and looked at how the people that eat the Mediterranean diet live longer and they're healthier. So he tweaked it a little, and thus we have the anti-inflammatory diet. A lot of the illnesses are due to inflammation, and if you continue to eat inflammatory foods, then your body becomes inflamed. With the anti-inflammatory food guidelines, you eat foods that are lower in sugar, the body's able to digest it slowly, and then you don't have the markers or the inflammatory markers coming down and insulting the whole system at the time that you're eating. For example, something that's pretty simple is your omega-3s and your omega-6s. A lot of people will eat processed foods, crackers that stay on the shelf, anything with shelf life, long shelf life, safflower oil, different oils, sunflower oil, grapeseed oils. Those are omega-6s. They use them all the time in foods, processed foods, and you really want your omega-3s to be higher, 4-to-1 of omega-6s. You can get your omega-3s from fresh baked salmon. You can get it from using some canola oil or your monounsaturated oils like olive oils. You want to have more omega-3s than omega-6s. Both of them are inflammatory, but omega-3s are less inflammatory than omega-6s. But the majority of the population eats a lot more omega-6s than 3s.